In today's video, we will be revealing early signs of breast cancer you must know and the best treatments for breast cancer. First, what is breast cancer? Breast cancer is a type of cancer which invades the cells and tissues of the breast. It occurs predominantly in women with a rare occurrence in men. Breast cancer formation starts either in the lobules or ducts of the breast. Breast cancer is the most dangerous and invasive form of cancer in females, and when not treated timely and not properly can be lethal. Breast cancer is cancer that develops from breast tissue. Secondly, what are the early signs of breast cancer? Signs of breast cancer may include: point 1. A lump in the breast. 2. A change in breast shape. 3. Dimpling of the skin. 4. Fluid coming from the nipple. 5. A newly inverted nipple. 6. Red or scaly patch of skin. In those with distant spread of the disease, there may be bone pain, swollen lymph nodes, shortness of breath, or yellow skin. Texture changes to the skin on your breast, such as a rash, redness, or dimpling. The skin could resemble the peel of an orange karma swelling in your armpit or near your collarbone. This could mean breast cancer has spread to lymph nodes, small organs that are part of your immune system in that area. Pain and tenderness. Although lumps don't usually hurt, some may cause a prickly feeling, a flat or indented area on your breast. This could happen because of a tumor you can't see or feel. Breast changes, such as a difference in the size, karma, shape, texture, or temperature of your breast. Changes in your nipple, like one that pulls inward, dimpled, burns, itches, develops sores. Unusual nipple discharge. It could be clear, bloody, or another color. A marble-like area under your skin that feels different from any other part of either breast. Who can develop breast cancer? Risk factors for developing breast cancer include being female, obesity, lack of physical exercise, alcoholism, hormone replacement therapy, during menopause, ionizing radiation, an early age at first menstruation, having children late in life or not at all, older age, having a prior history of breast cancer, and a family history of breast cancer. Fortunately, medical advancements has helped in early detection and treatment of breast cancer, which has brought a significant decline in the death rates. The most common symptom is a new lump in your breast or armpit that doesn't go away. Cancers developing from the ducts are known as ductal carcinomas, while those developing from lobules are known as lobular carcinomas. Diagnosis and treatment of breast cancer. 1. Biopsy. Biopsy is a medical test commonly performed by a surgeon, interventional radiologist, or an interventional cardiologist. The process involves extraction of sample, cells or tissues for examination to determine the presence or extent of a disease. The tissue is then fixed, dehydrated, embedded, sectioned, stained and mounted before it is generally examined under a microscope by a pathologist. It may also be analyzed chemically when an entire lump or suspicious area is removed. The procedure is called an excisional biopsy. An incisional biopsy or core biopsy samples a portion of the abnormal tissue without attempting to remove the entire lesion or tumor. When a sample of tissue or fluid is removed with a needle in such a way that cells are removed without preserving the histological architecture of the tissue cells, the procedure is called a needle aspiration biopsy. Biopsies are most commonly performed for insight into possible cancerous or inflammatory conditions. When cancer is suspected, a variety of biopsy techniques can be applied. An excisional biopsy is an attempt to remove an entire lesion. When the specimen is evaluated, in addition to diagnosis, the amount of uninvolved tissue around the lesion, the surgical margin of the specimen is examined to see if the disease has spread beyond the area biopsied. Clear margins or negative margins means that no disease was found at the edges of the biopsy specimen. Positive margins means that disease was found and a wider excision may be needed, depending on the diagnosis. When intact, removal not indicated for a variety of reasons, a wedge of tissue may be taken in an incisional biopsy. In some cases, a sample can be collected by devices that bite a sample. A variety of sizes of needle can collect tissue. In the lumen core biopsy, smaller diameter needles collect cells and cell clusters. Fine needle aspiration biopsy. Pathologic examination of a biopsy can determine whether a lesion is benign or malignant and can help differentiate between different types of cancer, in contrast to a biopsy that merely samples a lesion. A larger excisional specimen, called a resection, may come to a pathologist, typically from a surgeon, attempting to eradicate a known lesion from a patient. For example, a pathologist would examine a mastectomy specimen, even if a previous non-excisional breast biopsy had already established the diagnosis of breast cancer. Examination of the full mastectomy specimen would confirm the exact nature of the cancer, subclassification of tumor, and histologic grading, and reveal the extent of its spread. Pathologic staging. Liquid biopsy. There are two types of liquid biopsy, which is not really a biopsy. These are blood tests that do not require a biopsy of tissue. Circulating tumor cell assays or cell-free circulating tumor DNA tests. These methods provide a non-invasive alternative to repeat invasive biopsies to monitor cancer treatment. In addition, because cancer is a heterogeneous genetic disease, and excisional biopsies provide only a snapshot in time of some of the rapid test available drugs against the circulating tumor cells, evaluate the mutations in cancer, and plan individualized treatments. Dynamic genetic changes occurring in tumors. Liquid biopsies provide some advantages over tissue biopsy-based genomic testing. In addition, excisional biopsies are invasive, can't be used repeatedly, and are ineffective in understanding the dynamics of tumor progression and metastasis. By detecting, quantifying, and characterization of vital circulating tumor cells or genomic alterations in C2C and cell-free DNA in blood, liquid biopsy can provide real-time information on the stage of tumor progression, treatment effectiveness, and cancer metastasis risk. This technological development could make it possible to diagnose and manage cancer from repeated blood tests rather than from a traditional biopsy. Some people with breast cancer will have only one treatment, but most people have a combination of treatments, such as surgery with chemotherapy and radiation therapy. You may also have immunotherapy, targeted therapy, or hormone therapy. Clinical trials might also be an option for you.
Finally, if you notice any of the aforementioned signs or symptoms, talk to your physician immediately. This is My Health by Dr. J. Like this video. Subscribe and follow My Health by Dr. J for more of your health videos.